Okay, here we've got the static postural assessment performed in a relaxed standing position. The athlete is barefoot, feet positioned hip width apart, and arms relaxed by the side. There's no verbal postural correction is provided in this position. From here, we've got the anterior view captured with the camera position at approximately hip height. A vertical plumb line was dropped from the bar above with a 1 kg weight on it. This is used for reference of symmetry. From here, we observe for head tilt rotation, compare shoulder heights for asymmetry, which may indicate cervical or thoracical, so postural adaptations. Also here, we're looking for pelvic alignment, comparing anterior iliac spines and noting any lateral pelvic shift. On the knees, evaluate the knee alignment for valgus or varus position, which may reflect proximal hip control or distal foot influences. Also assess the foot progression angle, medial arch, and overall symmetry between the left and right sides. Posterior view will be recorded with the camera again positioned at hip height. The plumb line is referenced through the spine and the midpoint between the heels. So what are we assessing here? We are going to observe the scapula height and position, noting any asymmetry or winging, assess the spinal alignment for lateral curvature or trunk shift. In the pelvis, we'll compare the iliac crest height for assess for pelvic symmetry or asymmetry, which may influence the lower limb loading during running. For the Achilles and calcaneus, we are assessing the Achilles tendon alignment and calcanea position for signs of excessive for eversion and inversion. A plumb line is used here in the lateral view, passing through the greater trochanter, the lateral malleosus, and also the shoulder. What we are viewing here is we're assessing for forward head posture relative to the plumb line, which may reflect the cervical loading patterns. Thoracic spine, we're observing for thoracic kyphosis and lumbar lordosis to identify excessive or reduced spinal curves. Pelvis and hips, assessing the pelvic tilt, noting anterior, posterior to pelvic tilts. And knees, we're observing the knee flexion angle and the extension angle.